What happens when a country loses its doctors? We don't have to imagine it. It's happening in Nigeria. Doctors are leaving in droves and the consequences are deadly. Let's talk facts. The World Health Organization recommends one doctor for every 600 people. In Nigeria, we have one doctor for every 3,474. Some estimates say 1 to 2,500. That's a disaster. 16,000 doctors have left Nigeria in the past 5 years. Just 55,000 remaining to serve a population of over 220 million people. And who can blame them? A Nigerian doctor earns 250,000 naira a month. That's under $200. In the United Kingdom, they earn over 40 million naira a year. But this isn't just about money, it's about dignity. Imagine walking in a hospital with no electricity, ventilators don't work, oxygen is scarce, and you have to buy your own gloves to save lives. Imagine watching someone die, not because you lack the skills, but because you lack the tools. And when doctors speak up, they're branded unpatriotic. Meanwhile, politicians fly abroad for routine checkups. This isn't just a doctor problem, it's a national emergency. Nigeria's maternal mortality rate is 576 per 100,000 births, the fourth highest in the world. Our life expectancy is just 56 years. People are dying from treatable illnesses, not because we lack the cure, but because we lack caregivers. Here's the truth. If we don't value our doctors, we don't value our lives. We must pay them better, fix infrastructure, and offer career growth, not as a favor, but for our own survival. Because if this Japa wave continues, we won't just lose our doctors, we'll lose lives. The time to act is now.
This Japa thing, there was a time it was front and center when the federal government was trying to, or some state governments were trying to, let me use this word lightly, kidnap the doctors and make them stay and make sure they don't go anywhere, that they have to stay.
Nigeria.
Yeah, they have to stay for a minimum of 5 years or so, and there was a lot of uproar. Nothing has changed. It's gotten worse. The numbers are alarming, 55,000 only to 200 million people, meaning that more than half, three-quarters are not getting any health care whatsoever. The buying of gloves didn't start today. We bought gloves in the early 90s when I had to work in the lab, and you have to take samples from different places. We were buying gloves then, and it's just terrible that that is still occurring. But what do you expect from a nation where even from the top, they're not taken care of here. They travel to France, to London, get the best. Now, if you were being treated here, you would make sure that even at least the primary health care centers are basically equipped. Not that you have some makeshift makeup box with methylated spirits and cotton and maybe plaster and iodine. You need to make sure that the people have the basics. But you can see that if you don't have money, you're going to die. Simple, straight, and finished.
Sometimes even if you have money.
But at least you have option. I'm saying if you have money, you have an option. If you have no money, you have no option.
You know, this is a topic of which comes first, the chicken or the egg?
Ato.
Because you see, everything you said is great. You know, the question at the end of the day is what's the solution? And we have to be very practical here. I was, you know, when I was, you know, reading about this, I saw a recent comment by the Minister of Health, Mohammed Bate, that Nigeria spends $21,000 per doctor. I mean, the cost of
to train a doctor.
It's about $21,000. I mean, maybe that is questionable because 21,000 right now is almost over 30 million naira current exchange rate. But we could say that to a large extent that, you know, because you get this
subsidized education.
Subsidized education, that Nigerian doctors are subsidized, which is the reason why they are attractive to other countries, because they're able to get high quality doctors and with less training and less conversion. So if that's a challenge that we have, that we're spending a lot more to subsidize the training of doctors and then they go out of the country, question, should we still subsidize their education? One, if we subsidize their education, should we get them to
Sign a bond.
sign a bond to say you're going to have to stay?
So because you subsidize their education, you will not pay them well.
No. So I know, I agree
you
with
pay them
you.
well, but
I
they
agree with you.
shouldn't, Japa. That's a classic
saying
case of
them well.
monkey they walk baboon they chop.
I don't think there is
I'm trying to
any
say that
education in Nigeria,
there has
tertiary
to-
education in Nigeria that is not subsidized.
I'm just saying that we have to be practical here, and see that, maybe instead of subsidizing their training, the money we're using to subsidize them, we should use to guarantee their pay, so that when they get out, they know that they're going to be paid
I don't
like the
mind that.
contemporary out of the country. So we have to have that conversation.
Two things for me stood out in your advocacy. What happens when a country loses its doctors? What happens is wahala and the katakata you're talking about. We won't just lose doctors, we will lose lives.
Yes.
We are already losing lives.
We are.
About 10 years ago, my daughter had a burn accident. And I discovered there was no single pediatric burn specialist in the whole of Kwara. There were burn specialists, there was no pediatric burn specialist. I had to be bringing in a doctor from Ibadan every other day to come and check her out. It was financially draining, but that was the only option we had, because the other burn specialists, they were not adequately equipped.
For children.
For children. She was in a lot of pain. Recently, a friend close to me is looking for a pediatric neurologist. We found one, but this one person had a family emergency, so they've been unable to see the neurologist for the past 3 months. It's a nightmare. Like, you literally have the money to pay for the services, but you can't even
Which is why you said even with the money, you will
the
not.
services. There is a huge gap, and the gap did not start now. Even before the Japa I'm talking as far back as 10 years ago.
Yeah, or more.
It's a thing.
Yeah.
The moment you leave Lagos and Abuja, any other form of specialist, you have to fight tooth and nail to access them. It's gotten worse now.
Yes,
like
progressively
day by
worse.
day. When you go, and every time I'm always saying, oh, we are looking for this specialist, because I do some form of recruitment. Like, we're looking for this medical specialist. You can't even find them. And like you said, the pay is
Atrocious.
Atrocious is the word. The only way we can make this better is to improve the pay. Not just improve the pay, improve the working conditions.
Yes.
Because doctors are constantly lamenting.
How are you performing operation with torchlight from your phone? With light from your phone?
And we need
no
to
power.
And we need to aggressively invest in the health sector. You go to some health sectors, even me,
Father Lord,
as a patient, you start feeling fine immediately, because you're like, well, I can't stay here.
I like that you said something about being practical and then solutions as well. And you spoke to infrastructure already in your advocacy. But might I also add that when it comes to specialized medical service, the scarcity is actually a global thing. It's not just Nigeria. So maybe this is an opportunity for parents to also try to encourage their children to go into certain areas of medicine. Because I know people who come in from the UK and from Canada to see a gynecologist in Nigeria, right? That's on one hand. And then I don't buy the idea of removing whatever subsidy we still have in education right now, because every time we talk about there being a problem in any sector, there's always this space of hiding under, oh, well, you are getting it cheap. Whether we're getting it cheap or not, please, what exactly is a Nigerian gaining as a Nigerian right now that is being subsidized? The only one that was trickling down to everybody was fuel subsidy, and now it is gone. So please, what exactly are they subsidizing, or is the government subsidizing for the people? If it's just education, I don't believe that education cannot work because it's being subsidized, right? Now, we need to talk about remuneration. So they go to other countries and they are paid well. But nobody is saying the Nigerian government should probably start paying them $5,000 or $2,000 per month. That's not the idea. The point is, people need to earn take home that takes them home. Right?
Wage.
When you earn $3,000 or $5,000 outside the country, we know how much goes back into maintaining your lifestyle in a month, right? So if we're going to look at remuneration, our government just needs to be empathetic in their leadership, because you need to go back to what they are earning. How many of them can easily say, oh, I have worked 5 years and I can say that I'm earning 1 million naira a month. It doesn't happen.
How many can buy brand new cars?
You know, it doesn't
forget brand
happen.
new. What
So
up
we
to?
need to go back to the drawing board and actually give them something that can actually take them home.
As teaching time saves 9, so too a state of emergency saves a national disaster.
Indeed, Gbenga. However, I'm beginning to wonder if the distance between emergency and disaster isn't shorter than we sometimes think.